Hi everybody, my name is Xiao Xiao and I'm a medical student. If recently you guys have been reading the news, you probably noticed that there is a very deadly Ebola virus outbreak in West Africa. And currently in this outbreak, about 51% of the patients die of this disease. And if you're wondering why is Ebola virus so deadly, how does it kill, and why it is such a big deal in the news, I'll explain to you exactly what is Ebola and how does it function in our bodies. So currently we do not have any treatment or a vaccine for this virus, and we do not have a complete understanding of what it does, but I'll summarize what we know in the following video. So Ebola is transmitted through bodily fluids, and once it enters your body, it goes into your cells, and inside your cells it will start replicating itself. And these viruses replicate extremely fast. They can go from one virus to about tens and thousands of viruses in just a matter of days. And once they replicate themselves, they'll just storm out of the cells and go to neighboring cells to infect the next cell. In the process, they will actually destroy and kill the cell. So as the virus spread, they will kill many cells and many tissues. However, normally your body is able to elicit an immune response to clear many types of viruses and bacterial infections. For example, in the case of flu viruses, your body is eliciting a response to clear the viruses, so that you actually have a symptom of headache, fever, chills, maybe diarrhea, and all these are actually not what the viruses are doing. They're the battle that your immune system's fighting against the viruses. However, in the case of Ebola, the first cells they kill when they enter your cells are actually your immune cells. So in Ebola infection, you still have this flu-like symptoms such as headache, fever, chills, but your body is no longer responsible to elicit a powerful immune response to clear the Ebola viruses, and because the immune cells are just dead. And as a result, the Ebola virus is able to spread everywhere in your body, and in the process, they destroy tissues in the liver, in your intestine, in your skin, and a lot of patients have tissue damage and skin damage. And on top of all that, the proteins on Ebola virus can somehow elicit blood clotting in your bloodstream. So your body will just suddenly have this non-specific random blood clots, and that in itself is bad enough. But because all this blood clotting is consuming all the clotting factors in your bloodstream, and because your liver cells are destroyed, they're unable to produce more clotting factors, and as a result, your blood just does not have clotting factors anymore, which causes just spontaneous bleeding. And once you start bleeding, it's very hard to stop it because you don't have the clotting factors. This is why you see in patients, in their pictures, you see blood everywhere, just blood oozing through their bodies. And so because this virus replicates very fast, they destroy your tissues and they just destroy your immune system, so you're even unable to clear the viruses. It is a very deadly disease, and I've mentioned historically the death rate has been as high as 90%, and currently it is about 50%. However, because the disease is transmitted through the bodily fluids, it is actually not very efficient at spreading. So with the medical procedure, isolation, and just wearing gloves and protective gears, we can actually prevent Ebola virus from spreading. And the current outbreak is caused both because Ebola's initial symptom is just fever and chills is very non-specific, so it's hard to identify what it is. And at the same time, in these African villages where the outbreak started, there wasn't enough medical care, so that the patient's family and the healthcare workers wasn't protected from the virus. But as long as we wear protective gears, wear your gloves, even though the virus is very deadly, we can prevent the spread of this virus.